Although we're a developed country, when it comes to prevention issues, we still lag behind in some aspects. And by assuming we're not at risk, we don't go and get tested, but it's really important to know our status always. There is a lot of stigma and discrimination attached to having HIV. So women, at the beginning of the epidemic, they pretty much didn't account for a lot of percentage, 6% in 1995. Currently, 28% of new diagnoses each year comes from women. It is in Ontario and in Canada. People from countries where HIV is endemic, the population number is small, but the infection rate is really high due to different reasons. Why does this happen? It happens because other than the virus, with what we call social determinants of health, meaning that factors and conditions that interact to influence our health outcomes for individuals and communities in general. So basically, in 2005, the United Nations created a commission for social determinants of health, and Canada has accepted about 12 of them, including income and social status, culture, gender, social support networks, education, all these things that interact to influence our health outcomes. I put with a different color the lack of legal status and put question marks, because we at Voices of Positive Women say, if you don't have a legal status in Canada, you don't have jobs, you don't have access to medication, so definitely your health outcome is adversely impacted. So maybe we should find a way to incorporate the lack of legal status in between. It is a matter of a right issue, so that's one thing. Why do we focus on women? Women account for about 28% of new infection in Ontario and in Canada. Pre-1995, 6%, 2000 to 12%, 2008 to 27%. So it's really growing infection. So what puts women at risk? Women are at risk due to biological factors. Male to female transmission is very successful. More HIV is found in semen versus vaginal fluids, and there is pretty much little or no symptom of sexually transmitted diseases in women, which means increased risk for HIV, because we don't know our STI status unless we go and check regularly. Also, social factors, like I said, in the social determinants of health, women's experiences with marginalization, with oppression, such as poverty, racism, immigration status, transphobia, domestic violence, all of them directly relate to the risk of HIV infection. Ability to negotiate safer sex practices, as well as their ability to access appropriate health services and education materials. So what are some of the risk factors for women again? There is definitely gaps in HIV education about risk factors. If tomorrow I have flu-like symptoms and I go to my doctor, because I'm a black woman, he would likely suggest HIV/AIDS test. Most of my white friends who went to college with me, they probably sleep with, not probably, but sometimes they want to check and the doctors will be like, hey, you're not at risk, you know. So even our healthcare providers and women's agencies don't put all of women as at risk, don't see every woman as risk. Every woman is at risk. So just to say that there is a gap in that. There are gaps in prevention, care, and support education, especially for marginalized women. So there is a need for targeted prevention, including working with Aboriginal communities, women from endemic countries, and LGBTQ. Voices of Positive Women is a provincial, community-based organization. It is non-profit and it's directed by HIV-positive women, and it is trying to better lives for women living with HIV/AIDS across Ontario. Voices aims to empower women living with HIV/AIDS through confidential support, outreach, information, and education, represent the issues of women living with HIV/AIDS in order to improve HIV positive women's quality of life and educate the public by promoting accurate and affirming images of people living with HIV/AIDS. So just to give you a background information, it was incorporated in 1991. It was founded by two positive women who saw the need for having a service exclusively designed to better the lives of HIV positive women. So it is directed by and it is for HIV positive women. Basically, members are at the core of our service programming and our service delivery and programming. All of our board members, some of our staff, and many of our volunteers are HIV positive. So membership, we have over 950 plus members across Ontario. The criteria to be our member is one has to be HIV positive and 16 years of age, as well as identify as a woman. We are a trans-inclusive organization. We can't stop this. Prevention is still our best option.